So obviously when people come to my clinic, they come to my clinic for a reason, and most of the time it's pain when they're using their shoulder for different activities. Most of the time when you have a shoulder injury, it doesn't hurt too much if your elbows are closer to your body. So if you're in the gym and you're doing more kind of biceps, triceps workout with your elbows closer to your body, you don't have as much pain. People end up having a lot of pain with just kind of activities of daily living. One big thing they have is just getting dressed in the morning, just taking your shirt off, on and off over the top of your head. Females putting a bra on, and many times even just driving your car where you kind of have to turn the steering wheel. The reason these things hurt is because it's usually a combination of two things. You can get a small tear to the rotator cuff, which then when you raise your arm out to the side, you're kind of isolating that muscle and that tendon, which causes pain. And then any kind of rotational movements of the shoulder, sometimes the bicep tendon can get up underneath that small tear of the rotator cuff, and that's when you can have that sharp shooting type of pain. So it really bothers people when their arms are away from their body. Like I said, taking shirts on and off, reaching for things in the refrigerator, anything where you reach behind your body. These things can all cause a lot of pain. And it's very disturbing to people because they don't understand why it's happening, and they don't understand why sometimes it doesn't hurt at all, and other times you have that really sharp, terrible pain. So I educate the patients on why it's happening, and then we talk about treatment options to get them back to 100%. So everyone gets concerned that if you have a partial thickness tear, that means automatically you have to have surgery. There's probably 30 to 40% of the people walking around the world today that have these partial thickness tears that are asymptomatic. So our whole goal is to see if we can get your full range of motion and strength back with real simple conservative treatments. One thing we always do is get you started on anti-inflammatory. People that don't like to take over-the-counter medications, a lot of times they're taking turmeric, kind of an all-natural anti-inflammatory. And then many times when they come in, if that's not working, we get them started on either a meloxicam, which is a prescription strength anti-inflammatory, or sometimes just over-the-counter Motrin. Solutions: when people come in and they have that really debilitating sharp pain to the point where it's waking them up at night, they can't get dressed, they can't even just do regular functional activities, specifically working out. Many times that's if they've already failed kind of the conservative treatment of anti-inflammatory, some rest, some ice. A cortisone injection can work great for that. What that does, it's a massive dose of an anti-inflammatory right to where the problem is, decreases inflammation, decreases pain. Obviously, it doesn't magically make a tear go away, but many times it can make the symptoms go away, so then people can properly rehab and get back to 100%. Many people come to see me and they've waited 3 months, 4 months, 5 months, 6 months to come in to be seen. They've already tried all the conservative treatments. They've tried therapy and injections and anti-inflammatories. And if it's still affecting pretty much one of three things, either occupation, recreation, or sleep, sometimes one of those, sometimes all of those. Sleep is probably the number one thing that bothers people the most. If you can't sleep, people come to see me pretty quickly. That's when we talk about surgery. And the surgery to get people better is all done arthroscopically and has a very high success rate. It does take a little bit of time to recover, but people are really happy to kind of be on the road to recovery and get rid of that debilitating pain that they had. Many times people don't come to see an orthopedic surgeon or any sort of specialist because they're concerned if you're going to go see a surgeon, the surgeon's just going to recommend surgery. And the good news is 80% of the time we get people better with real conservative treatments, therapy, anti-inflammatories, and injections. Only 20% of the time is this something that ever requires any type of surgical intervention.